Research.
Very good evening. Thank you so much, everyone, for showing up. This has been long overdue, but it is really important. So, please welcome representatives from Belfleet. Let them introduce themselves. Of course, let's just congratulate them for taking the trip to Horton. It is something that we do to everyone who comes here for the first time. So, thank you so much, and please go to yours.
Good evening, folks. Well, thank you for being here. My name is Juan Campbell. I'm Vice President of Sales for Wellfleet Student Health, responsible for sales and service of our client accounts. With me is Ashley Salvador. Ashley is the account manager for the Michigan Tech University Health Plan. So she's actually, I kind of call her my right arm, but she's actually the one that knows everything about the plan and can confirm benefits. So glad to have her here. Thank you for inviting us to present to you and provide a little bit more detail about your plan and how it works and the value of the health insurance that Michigan Tech offers the students here for international program. So without further ado, I'm going to talk about student health insurance and Wellfleet. So here's the agenda. We're going to give a little bit of background about Wellfleet, the plan value. So what is it worth, really and truly? Let's spend some time on insurance terminology. What do these terms mean? You hear a lot of terms, codes, abbreviations. What do they really mean? Your share of the cost. So what the plan covers and what you're required to pay. So we're going to talk a little bit about that to hopefully clarify, demystify that. PHCS, National PPO Network. What doctors take my plan? What hospitals take my plan? Is it a national plan? Is it widely recognized? And is it widely accepted? Talk a little bit about new added coverage, the dental coverage for adult dental. And then most importantly, what to do when you get a medical bill at home or in your email or in your mailbox. What do you do when you get, generally something has happened if you get the bill directly. So we want to talk about that. So, Wellfleet. We were previously CHP, Consolidated Health Plans. We've been in the business, in the market, offering student health plans for over 25 years. We currently offer coverage to over 250 colleges and universities across the country. About 170,000 students are covered under our plans. We provide ACA compliant plans. I keep doing this, so I apologize. I'll get used to this mouse. We provide ACA compliant plans offering comprehensive medical coverage and access to a national network offered by PHCS, which is private healthcare system, one of the largest PPOs in the country. Here's a list of client schools that we provide benefits to. So we provide benefits to NYU, New York University. There's 26,000 students that participate on that plan at NYU. UMass Amherst, where we're from Massachusetts. That's our corporate headquarters. There's 12,000 students on that plan. University of Wisconsin-Madison, both the domestic plan, the undergrad, and the international plan. We offer coverage in California at University of Berkeley. There's 33,000 students on that plan. University of Vermont, closer to home. Johns Hopkins, 5 campuses. UNLV, undergrad and the medical school, as well as Hofstra in New York. These are just some of the, and Michigan Tech is there, but these are just some of the colleges and universities across the country that we provide benefits to and answer questions and cover claims under with a variety of networks, including PHCS. So, what's my coverage worth? What is this? What's the value of this? And I'm going to talk a little bit about ACA metal tiers. So, why am I introducing metal into the discussion? Well, different kinds of metal have value. So, precious metals. So, when the ACA, the Affordable Care Act, went into law in 2010, they actually defined what health insurance is by the value of what an insurance plan pays. So, they broke it into 4 precious metals: bronze, silver, gold, and platinum. I don't know if anybody has a chain around their neck or a bracelet, but everybody wants a gold and a platinum bracelet. Not many people want the bronze penny bracelet, but I see a few. So bronze basically provides 60% coverage of healthcare costs. So when you buy that plan, the premium is very low, $1. The premium for the bronze plan is very low. But the deductible, we'll go into terms in a minute, but the deductible is very high. And the out-of-pocket maximum is very high. So basically, a bronze plan is built for someone to say, I don't use medical care that much, so I want to pay the lowest premium, and when and if I get sick, then I'll have to pay more money. So they look at it and say, what are the odds of me being sick? What are the odds of me needing care? I'm going to buy a bronze plan. Bronze plans, there's a bronze plan actually offered here, one of the Husky plans for the employees of Michigan Tech, the $3,000 deductible plan. It has a high deductible because that's when you pay at the time of service. The silver plan covers 70% of your medical costs. So the premium is a little bit higher than the bronze, the deductible is a little bit lower, and your out-of-pocket cost is a little bit lower. Silver plan across the country, probably one of the highest plans being offered at employers. The gold plan, 80% coverage, healthcare cost, has a little bit higher premium, but your deductible is a mid-range. Not a $3,000 deductible. It's closer to maybe a $500 or $1,000 deductible. Then your out-of-pocket maximum is capped at a lower dollar amount. And then platinum, well, that's the Lexus or the Cadillac, or pick one of those kind of names of something that's very valuable. The platinum plan pays 90%. By the way, there's no plan that pays 100% of cost. There's always a plan with cost share, plan where a carrier pays something, you pay something. But the platinum plan pays 90% of healthcare costs. Well, in order to do that, you pay a large premium. In order to do that, you have a lower deductible and lower out-of-pocket max. So a platinum plan, the premiums are higher, but people who have chronic conditions, who know they're going to see the doctor often, they buy platinum plans. So the Michigan Tech plan, where's that fall into? It's an 80% plan. So Michigan Tech has requested that Wellfleet provide benefits that cover basically 80% of your healthcare costs. And you have roughly 20% of the balance to pay through deductibles, co-pays, or co-insurance. But it's a gold plan that's offered to the students here. I will tell you, for Wellfleet's book of business, even those colleges and universities, just a sample that I shared, 85% of all of the plans are in gold or platinum. And that's actually by design. Most of the schools tell us, we want a rich plan for our students because students can't afford the high deductible. They're not employed. So they don't have $1,500 every time you turn around to pay for a deductible. So they want something affordable. So gold plan is what's offered here. Okay, insurance terminology. What do these terms mean? Co-insurance. I got insurance. What's co-insurance? Right? So co-insurance is basically a percentage of the covered medical expenses that we'll pay. It's separate from your deductible and it's separate from your copay. So it's a percentage. You folks are smart folks. Not a flat dollar amount, it's a percentage. So if something is 80% of $100 is $80. Right? It's a percentage. A copayment is a flat dollar amount, a specific dollar amount that you pay for very specific services. So, good example of a copayment is when you go to Walgreens and you get a prescription filled and you have a $25 copay. It's a flat dollar amount. You pay each time you receive a specific service. So, co-insurance is a percentage, 80% or 20%. Copayment is a flat dollar amount. The deductible. How many people drive cars here? Got it, good. You probably have insurance for those cars, right? And with that insurance for those cars, guess what's included in there? A deductible. A deductible is the amount you pay before the insurance pays anything. So when and if you have a car accident or you're in an accident, right, you might have a $500 deductible to get your car fixed. The insurance is going to say, well, we figured it, the car can be repaired, but you have the first $500. In health insurance, you have a deductible also. In this case, it's $750. You pay the first $750. So you pay the $750 deductible, right? Then any other services you have will have a co-insurance, 80%. Certain services, specific services, might have a copay, so they don't have co-insurance at all, like prescription drugs. Preferred allowance. I really don't like this term, but this is the term in your contract. Basically what it's saying is we negotiate, or through our partners, PHCS, negotiate with physicians and hospitals so that we have a contracted fee, a preferred allowed fee that they will charge for those services. We call those providers in-network providers. They're part of the network and we have a contract with them so we understand what their cost will be. There are other providers that are not in the network and therefore they won't agree to the preferred allowance. They will charge usual and reasonable. We call it usual and customary or usual and reasonable. It simply means the average charge in the absence of insurance. If there's no insurance, this is the average charge of what that provider should charge for that area. It's basically based on a zip code. If you go and get an x-ray, chest x-ray, for a particular zip code, and the providers in that area should charge about $150 for that. If there's a provider charging $600, they are not charging usual and reasonable for that service. A few more terms. So non-preferred providers are basically providers who are out of network. They're out of the PHCS network. They've not agreed to a prearranged charge for services. And so they'll be charging the usual and customary. But they're physicians, hospitals, other healthcare providers who've not agreed to a contract. So they're called out-of-network providers. So when you hear those terms, make sure you use an in-network provider. It's because we know we've already negotiated on your behalf what their charge is going to be. So your cost is going to be lower anytime you use an in-network provider versus an out-of-network or non-preferred provider. Preferred providers are in-network. Okay, out-of-pocket maximum. And I know I'm throwing a lot of terms at you, but watch, this is all going to work. Out-of-pocket maximum is really a safety net. That's what it is, maximum. It's out of pocket. How much are you going to pay is a maximum that you will pay every year. It's a safety net. It means the most you will pay during a policy year before the plan pays 100%. So there is a safety net with insurance. So let's apply it to your plan. And I just basically took a snapshot to try to explain these terms and then apply them to the dollar amounts that you might see in your certificate or your policy. So over on the left-hand side is cost share. Cost share is basically, we share the cost. We share the burden of what it costs for healthcare. Carrier pays a portion, you as a member pay the portion. So I talked about your deductible. Your cost is $750 as an individual, and if you have a family enrolled in the plan, also a spouse or dependent children, then it's total of all of you together, $1,500. But for all individuals, you pay the first $750 deductible, then the plan starts to kick in. The co-insurance, right, that percentage that the plan pays is 80% of the preferred allowance. So it's 80% of the contracted amount. And notice I'm using in-network PHCS, so in-network private healthcare systems. The plan will pay 80% of a physician's bill, and you have the responsibility of 20%. Your copay, and that's that specific service, for prescription drugs is $25 for generic, $35 for brand name, and $60 for non-brand, okay? Non-preferred. So it's a flat dollar amount. Most drugs are going to fall in the first two classes, $25 copay and $35. And then that safety net that I talked about, the out-of-pocket max, is $6,350. So what that means is, if between your deductible, your coinsurance of 20%, and your copays, in one policy year, you reach up, you accrue, you pay $6,350, right? Then you're done paying. The next service you have, the plan pays 100%. Now, you might say, well, that'll never happen because that takes a lot of money and a lot of, right? There are actual visits and actual diagnosis of people being hospitalized who blow right through that. And when they hit, they go right through that, the plan pays 100%. Now, that's not, if you're doing financial planning, I'm not recommending that because that means you're either very ill or had a bad accident because that's what you need insurance for. But I want you to know there's a safety net as far as the amount you pay. Now, I focus on the in-network because the in-network is your better benefit. It's $750 deductible, 80% covered by the plan, and then a safety net of $6,350 for your out-of-pocket maximum. Your out-of-network, right, now you have a 50% coinsurance. It's equal, 50-50. So when you see a provider who doesn't participate with PHCS, your cost just went up. By the way, the plan's cost went up. We don't have a contract with them, so it's not a prearranged fee. So we're going to have to pay what they charge. So the rate goes up. So it's in all of our best interest to use private healthcare system, PHCS doctors. I'm going to show you how to start research and find them. Right. If you're out of network, by the way, there's no safety net. So if you continue receiving care from a provider out of the network, you're going to continue paying. So, PHCS. You can go to phcs.com. And when you do that, you'll come to this screen that says PHCS Multiplan. Multiplan is a division of private healthcare system. It's one of the largest PPO networks, PPO, Preferred Provider Organization. It is a contracted group of doctors and hospitals and health systems. There's, for PHCS, over 900,000 physicians and ancillary providers. Over 4,000 hospitals participate with PHCS across the country. We actually work with, we have 8 networks that we work with. All those colleges that I listed, we have 8 networks. We use Cigna also. Cigna is one of our primary networks that we leverage as well. But for the Michigan area, PHCS has the most providers in network. And so that's why we chose this network for you as opposed to Cigna. But you go to phcs.com, right? And you can actually go in and type in the provider or the physician's name, or you can type in their specialty, orthopedic, right? Ophthalmologist, whatever type of specialty. And then you enter the zip code, and it will pull up a list of providers in your area that participate in the plan. You'll get their phone number, and here's what I suggest you do. Yes, you found them on the website. The website says they're in network. You make that call, because you're calling to make an appointment. You want to confirm that they are in network with the health plan, that they continue to participate in PHCS. And they confirm that. If you need a language line, PHCS has a language line phone number right on their website. So if you feel a little uncomfortable explaining your situation, or you think they're not going to understand you or be clear, and you want assistance, dial into the language line and get assistance that way. But we want you, because it's in all of our best interest, to use in-network providers, because that's how the plan is built to provide the best value for you. So, locally, UP Health System. Right? I just went over the definitions, right, and the terms of insurance. Right? And right on UP's billing FAQs, look what they've got. What is a deductible? What is copay? What is coinsurance? And that's for everybody. That's not just for students. they have the toughest time making sure that everybody understands insurance terms. And so even the hospital, even the health system has a page describing what your cost share is in an attempt to, information out. But I can go to PHCS website and pull up UP Health System by typing their name in and the zip code, right? And it'll show that they participate on the PHCS website. I can also go here to UP System and look what they do. They've got PHCS listed too as accepted insurance providers. So when someone tells you they don't take the insurance, there's always ways to find out. Quickest way is to call. I will give you our customer service number, but call our customer service. We can assist you in confirming. But you can always go to the provider's website and do a reverse look. So they accept Aetna, Blue Care, Blue Cross of Michigan, Cigna, but there's multi-plan PHCS also. Your own health center. So you've got 4 facilities: the Upper Great Lakes Family Health Center, UP System Portage, UP System, Portage, I said that, and then Aspiris, all are in PHCS. So when you're using these services, you're already in network. So you're going to be at the 80% co-insurance that the plan will pay, and you'll have 20% co-insurance using these facilities. For the 2019-2020 policy year, we've added adult dental. So what's covered in dental? This is a medical plan. Well, adult dental is also included in this plan. And there are really 4 categories of coverage. And I'm just doing this high level. Your certificate, and I'll show you where to find the certificate on our website, but your certificate will go into more detail. But there's preventative services. Preventative services are cleanings, scalings every 6 months, so twice a year. Fluoride treatment, it's covered at 50% of the preferred allowance. And 50% if you go out of network. So it's a 50% benefit, but you've got cleaning, scaling, fluoride treatment. And then routine dental care. You can get the dental exams, x-rays, full mouth every 3 years. Every dental plan, that's their standard. Full mouth every 3 years. You get bite wing x-rays every 6 months. And then there's restorative care. So this is extraction. You have a tooth pull. That's covered. The fillings covered. So this is under the restorative. Stainless steel crowns and extraction are all covered under the restorative. Endodontics, so that's the gums. So if you have including procedures for treatment of disease pulp, right? And then prosthodontic is basically partials. So you can have removable or complete partials, including 6-month follow-up care. So it's a very comprehensive addition to the plan for dental coverage. All the services covered in a dentist's office, so this is not hospital care. So you're going to basically, on this particular part of the plan, there's not a PHCS network, so you go to any dentist, and it's 50% coverage of the preferred allowance.
Excuse me, can I say something?
Yes.
The first part was totally free last year. It was 100%.
Cleanings are 100%.
Yeah. So it gets worse.
The 2 cleanings are 100%.
No, the 2 cleanings are.
They are.
Yes. This is the, and maybe it's not as clear, but fluoride treatment covered at 50%. So your fluoride treatment. But the preventive is the cleanings are 100%. So it hasn't gotten worse, but thank you for that question. Exclusions and limitations, the fine print. So I'll tell you everything that's covered. So basically, if you get sick, you have an accident, you have an illness, you want prevention, you have symptoms, and you're going to your doctor for tests to uncover what could be wrong. There are so many things that are covered under this health plan, but they follow a basic rule. It must be medically necessary. So if you're getting a test because you are getting a job, right, and they need a physical, that's actually a third-party request. That's not medically necessary. So I'm trying to do the separation. So let me talk about exclusions and limitations. There's a couple of pages of them, and they're in the certificate, and I'll bring you to that page. But one of the biggest is you think about activities, they may be called recreational, but they're activities that are risky activities that could cause harm or accident are excluded. So all the stuff you like, racing, speed contest, rock climbing, parasailing, bungee jumping, four-wheeling, ATVing, all of those activities that may cause an accident and then an injury, the injury will not be covered because of those activities. If you think I'm being the bad person, I just want to say that when you go to do these activities and they give you the equipment to put on, there's these papers that they have and they hand you, and they want you to sign them. You're signing a waiver of liability because they don't want to be responsible for covering your injuries for these activities. You gonna ask a question?
Yeah, is that limited to just those specific activities, or is that just more of a general, broad stroke term, like covers the general terms in there?
These activities specifically are listed.
Okay, so there's like skiing or snowboarding, does that fall under those?
So skiing does not fall under it, right?
Okay.
But these activities, so rock climbing, yeah, it's and then the injury. So imagine this: these are not accidents that are caused by accident, even though you had an accident. You've elected to participate in this activity that caused accident.
So we do have an indoor wall. So in our in the student development in our sports complex. So
yeah.
Does the indoor wall constitute rock climbing, or is it just outdoors?
Yeah, that's an excellent question. I would refrain from answering off the cuff. It probably may be considered rock climbing. I'm going to research that for you. Yeah, no, that's a good question. We'll take that down.
Yeah.
We have an indoor one. So in my daughter's apartment on the first floor, they have an indoor. Most places, so it's funny. And my granddaughter's climbing. Weak, strained, or I'm going to read all of these, so this is going to get fun. But no, weak, strained, or flat feet. Basically, corns, calluses, ingrown toenails, except if for the treatment because of injury or infection. So expenses covered under workers' comp, that may not apply so much here. But basically, what it's saying is if a third party is responsible for your injury, the medical plan is not primary. So if you got hurt at work or hurt, at a Stop and Shop, right? You're going shopping or Walgreens. That's a third-party accident that should be covered by that entity. If not, then the plan would cover. There's other exclusions: loss resulting from war, charges for hearing exams and hearing aids that are fit or repaired, expenses incurred for plastic or cosmetic surgery. These are some of the normal ones. The biggest one for this group, though, is the recreational activities that I wanted to share. Someone had a question here.
Is the car accident related?
Yeah, let's talk about that. So I'm not sure what auto insurance policies are available in Michigan, but in Massachusetts, you could buy an auto insurance policy that has full coverage for collision, right? And then personal injury and bodily injury to yourself and bodily injury to others. You can also buy a plan that's called compulsory. It's the minimum insurance that you can buy to drive a car legally in Massachusetts, but it doesn't have coverage for bodily injury to other people. So when you think of car insurance, you say, well, geez, I got in an accident, right? And I got to get the car fixed. Well, that's your collision component. That's the insurance to fix the car and get it back, right? There's another component, it's called bodily injury, personal injury protection, PIP, that covers medical because of the car accident. Not only covers you, right, but it covers the other person in the car too, if you were at fault. So you have a component of medical insurance in your car insurance that must pay first because of the accident that occurred was an auto accident. When that is exhausted, your health plan kicks in. So it's not excluded. It's the health insurance isn't primary for auto accidents. And that might be a confusing term, but if you think it through, you have insurance for the car, you have insurance for you and your occupants of the car for any injuries. So that's when they take all the information and they do the claim, and then they say, we got to make sure we get all your medical bills for that accident because it's going to go to that insurance company, either to yours or maybe the other person that caused the accident. Once it exhausts that, then it goes on to the health care. So,
If a driver hits a pedestrian and the pedestrian is injured, who is responsible for the pedestrian coverage?
that's injury to other people that still should be covered under the auto. Okay.
Thank
You
you.
it should be covered under the auto. Here's the key, and this is what's difficult, and this isn't difficult for students, this is difficult for everyone. You have to be sure that you file the claim, that you get the other person's insurance, and that you share that information with your insurance company.
Michigan is no fault.
So Michigan has no fault.
It
Okay.
has no fault.
So the insurance company is going to cover it once the claim is filed. That's good. Thank you for that.
Yeah, so the item that you mentioned, the bodily injury and also the property injury, those are all were before in the minimum insurance, the insurance that we purchased before.
Right.
But there was a letter from CHP to all insurance agencies stating that we are not the primary, and that caused the increase in our auto insurance.
Cause an increase in your auto insurance?
Yes.
Like a rider had to be put on saying that car insurance would be primary for bodily injury. So the rider on top of the regular car insurance.
Understood, because now the auto insurance is taking on additional exposure. That was possibly being covered by the plan. And I'm not, again, familiar with Michigan auto, insurance rules, but in general, right, your auto insurance, your premium should take into consideration repair of the vehicle and accident and injury to the occupants of the vehicle and accident to injury to other occupants of the other vehicle. And that should result in the total premium of your auto insurance. Your auto insurance doesn't pay everything. That's when your health insurance kicks in, but your health insurance can't kick in until it knows what your auto insurance has covered. It's called coordination of benefits. It feels like it's a hassle, but when you have two different insurances, right, they need to work together, and you're the key as far as the information. So that's interesting, and I'd like to talk to you later about that, so I understand a little bit more about a rider, but I appreciate that. Sure.
So what would martial arts look like on that list?
I don't believe martial arts is excluded.
Okay.
Okay, so if you receive a medical bill, and what I mean by this, you will receive a medical bill. You will receive a bill because you have a 20% co-insurance. You will receive a bill because you have a $750 deductible. But if you know what your responsibility is, that your plan has a $750 deductible, and you went and saw a physician for $100 and it's your first visit, you have that obligation of the first $100. You will receive that bill. What I'm talking about is when you get a bill because you've been in the hospital for 6 days, and the bill comes directly to you for $20,000. When that type of bill comes and you don't get an explanation of benefits from us, right? An explanation of benefits basically says, we received the bill from the hospital or from the provider, we adjudicated or processed the claim for the correct amounts, deductible, co-insurance. We've paid our portion. Now here, you are going to be responsible for this amount. Right? When you don't get that from us and you just get the bill and it's for a huge amount, don't ignore it. Don't assume we received it. Because I'll give you a perfect example of how sometimes this can occur. Let's say, not an auto accident. Let's say you were skiing, right, and you hit a tree, and the emergency ambulance came, You're unconscious, by the way. You hit a tree, the ambulance came, they took you to the hospital. In your ski outfit, you didn't have your wallet. Oh, I said wallet, so now I'm talking about a guy, but okay. You didn't have your wallet, right? So you didn't have any ID. A couple of friends came with you. So when they register, you're going into the emergency room, your friends are at the desk. And they give you your name, and they say you're a student at Michigan Tech. And they give you information, and they start the process of the registration. A little later on, you come to, you're awake, so someone from the admitting department comes in and starts talking with you, and you give them all your information. Your home address, where you live, you're here at school, you had an accident. Say, thank you very much. Do you have insurance? Yes, I have a student health plan through CHB, through Wellfleet. Well, do you have your ID card? Not with me. I don't have my wallet. Okay, we'll bill you. That's the example. Now, I'm not wishing that anybody hits a tree while you're skiing, but if you don't have your ID card with you, there's no way for them to bill us directly. They're going to bill you. We don't want you to forget about that bill. The worst thing you can do is to let it go away, right? Forget about it. Anybody here have 850 credit score? You do if you don't forget the bill, right? Otherwise, you don't, and you go to collections. If that bill goes to collections, it's very hard for us. It's very difficult for us to hold it to the PHCS contract. So I gave you that example. So when you get those types of bills and it's not an explanation of benefits or an EOB, you want to contact our Wellfleet customer service, PO Box 15369. You can go to wellfleetstudent.com or you can call us at the toll-free 877 number. This is your group number, ST1062SH. I tell that story only because it actually happened. And someone was stuck with a $25,000 bill who had insurance. That is not the way it's supposed to work. When you go to Wellfleet Student, you're going to come to our landing page. You can list, it says search for your school. You can type Michigan Tech, it's going to come up. When I type in Michigan Tech, there's your school landing page. And it provides information about your benefits. There's an ID card view, claims. There's the dental information. There's a benefits at a glance, which is basically a high summary of your coverage. And then the summary of benefits flyer, and then a full certificate that goes into details. So if you do want to find out if rock climbing or, yeah, it's covered, yeah.
Martial
arts. The certificate goes into, it's the Bible, basically. I'm going to click on the flyer just to basically show you a high level. If it comes up here, yeah. This is just a high level flyer that you can go online and it pull down and you can make a copy, you can put it on your phone. You can do the same thing with your ID card. But it talks about over here, your deductible, $750. Your out-of-pocket maximum, $6,350. The co-insurance that the plan pays is 80%. Right? So 80% there. Out of network, it's 50%. So that's why we want you to go to PHCS.com and make sure that you use a participating provider. Your period of coverage, is the annual, or you can have certain terms. And I think the second page, has the premium. So on an annual basis, it's $2,577 for a student, $2,577 for a spouse, and then if you have up to 3, $2,577 for a family additional. Anyone after the 3, there's no charge for them, but all 3 of these add up to your total premium if you have a student, spouse, and child. That's on an annual basis. Maybe you're enrolled on the plan, on the health plan just for the fall, or maybe you're enrolled just for the spring. If you're enrolled in the fall, it's $1,077. In the spring, just for the spring period, it's $831. I understand that you can enroll for different terms. I know a lot of students enroll on an annual basis, but you're covered for that period. So if you enroll on an annual basis, the policy period is August 16th to August 15th, 2020. So you're covered for the year on an annual basis. So if you graduate in May, right, you're still covered because you paid for the whole year. So you're a covered member. But if you bought a fall term, right, you're only covered to January 15th. And then you have to buy the spring term. Okay, so that's how the insurance works. We offer it in terms, but we can also offer it on an annual basis.
Okay.
Yes.
So here, this house, so let's say that a couple both of the couples are students here.
Mm-hmm.
So they have insurance separately.
Mm-hmm.
And let's say they have a child and they want to cover the child as well. Right? So how can we tell the insurance that this couple, which both have different insurance, they got it separately, are actually together?
Yeah, so if you want to enroll together, you can actually enroll as the student, right? The premium isn't any different, so you enroll as the student and you add your spouse and your dependent before the enrollment period closes. Ashley, when's the enrollment period close?
The 29th.
The 29th?
The thing is that this house is also a student. And let's say she got the same insurance as well.
Yeah, so basically what you're doing is one of you has to be what we call the subscriber, right? Or the dependent. So even though you're two individual students, right, there's no benefit. When you look at the premium, it's going to be charged $2,577 for each of you for that example that you issued. Really, the benefit is to coordinate information. One of you is going to enroll as a student, right, and cover the child. The other will be enrolled as an individual student. But one of you has to enroll the child as your dependent.
So really, the benefit starts when your spouse is included in your family,
Mm-hmm.
because the maximum deductible is for the family. But if you just have your child under yourself, and you two can go for a maximum of $1,500, dollars, and then your spouse can still have its own deductible.
Sure.
So we don't want to do that.
Yeah, so what you want to do, though, is instead of enrolling as two individual students, one of you, and because you're both students at the college, one of you has to enroll as the primary student, and then enroll the spouse as a spouse, and then enroll the dependent all at the same time as a dependent. So you're enrolling your family to get those benefits. Yeah. So I can talk to you a little bit later about how to do that.
Yeah, the problem here is that if you're a funded student, then the university wants to pay for your insurance, then this thing doesn't work.
That's what we want to talk about. Because you have other levers, right, that are impacting your decision.
Yep.
Okay. I would tell you on it, okay, so we're all pursuing academic career so that we can be gainfully employed and provide for our families, right, and provide for ourselves and enjoy life. So when you're employed, you're going to be on the employer's plan, and you'll see the model works the same way, but you'll have situations where your spouse's employer, right, actually gives credits if they don't enroll in the plan and they go on your plan, because then they don't have to cover you or provide part of the cost of the premium. So it's just interesting, the different mechanics of insurance. So let's talk a little bit later. We'll go into, hopefully we can work something out there. And I'm going back here just to finish up. Sorry. How to contact us. Then a couple of you had submitted questions previously, so I hope in my presentation I've covered and answered some of those, and in some cases I haven't, so I'll do that now. So there was a question that says, I would like to know how the spouse-related insurance works. I'm not sure if a plan is here, but someone just asked a lot of questions about spouse coverage. We'll answer those a little bit later, but it basically says the coverage is available to your spouse. They can enroll. You are going to enroll them as your dependent, basically dependent spouse, and the premium is the $25.77 that you saw. Another question that was submitted is how much medical expense international student health insurance cover? Well, I showed you. It was a gold plan. It covers 80%. You're in the top tiers. So if you have a gold necklace, a gold bracelet, you have a gold health plan too. I would like to have a comprehensive understanding of benefits and conditions of my insurance coverage. I'm going to suggest that you look at the certificate because it lists. So you go to studentinsurance.com, pull up Michigan Tech, and click on the certificate. It will give you in detail all the things that are covered by the plan. Is dental care included in university health insurance? Yes. It's 100% preventive and 50% restorative. I want to know about annual physical check. Is there any option available to students for selecting what types of tests they want for annual physical, or can it not be changed? And the default is what the insurance policy provides. That's a very good question. Not well written, but we get what you're saying. Universally, right, there are procedure codes that all hospitals, physicians, and caregivers follow, and all insurance companies follow. And those procedure codes detail what services are provided in a group of care. So the annual physical has a whole list of preventive services that are included in it that your physician can pick from, right, and provide to you based on, these are some of them age-based. So some of these are you're getting shots, right, at certain ages. Some of them you're getting x-rays and mammograms at certain ages. There's a whole list of what is included age-based, right? Now, if there's something they say, well, I'd like to pick and choose, or my doctor isn't doing what I think should be done, that's for you to have a conversation with your physician about making sure that they're doing a total and complete physical exam. The insurance company doesn't pick and choose, right, what should be in a total physical or an annual exam. It's already predetermined by a whole host of about 200 codes of services that can be done. Not all 200 are provided to each of you because not all 200 are necessary. You don't fit into all the categories. Gender, age-based. So I hope I answered that question. It's complicated, but it is structured. Basically have a conversation with your physician about what you're looking for, what your concerns are. A couple more questions. Why can't Wellfleet cover primary rider and automobiles? I think we tried to answer some of that. We'll probably talk a little bit later about the rider and additional cost that the insurance is provided. But I tried to explain the difference between auto insurance, both the collision part and then the bodily injury, and then when that insurance or the health plan kicks in. Is coverage only for enrolled students? For example, if a student graduates in the fall, are they no longer covered by CHP during the spring semester? So the coverage period really depends on the term that you purchase. So we talked about if you purchase an annual, you're going to be covered for a year, right? If you purchase a fall or spring, you're going to be covered for that term. How widespread is the coverage for CHP? Well, we're national. We changed our name to Wellfleet in January. We were purchased by Berkshire Hathaway in 2011. We have grown. We have 4 regional offices across the country. We have an office on the East Coast. We have an office in South Carolina. We have an office on the West Coast, services the Berkeley account. We're national. And the networks that we use are national because we have to be flexible because we have colleges and universities all across the country. And not any one network is the best network for you, depending upon where you're at. So yeah, we're throughout the United States. What coverage is included for recreational activities? Martial arts. That one I know, we covered that one. A couple others we have to figure out though. But those that I listed, as far as excluded, if you considering those recreational activities, you want to be cognizant that if something happens, your medical plan may not cover. That doesn't mean I can't judge until you do it or not do it, just be aware. Does the policy cover chiropractic or physical therapy sessions? Yes, included in the plan. And then I would like to know whether my health insurance will cover accidents involving fractures or serious injury. So this is I say yes, because if you walk out that door and slip and fall on the floor, break your arm and have to go get an x-ray, you got a health plan there. Your health plan is going to cover that. It's going to cover it at the levels of your plan, but you have coverage. If you go climb a tree and you fall out of the tree, health plan's going to cover you. So yeah, if you have a fracture, serious injury, yes. What most people really should understand about the insurance is that accidents are so clearly understandable, medically necessary. Something has been broken, something has been injured, therefore it needs to be repaired. Those are very easy as coverage. The questionable ones are when I think I have this thing, but I'm not sure. So there's a battery of tests. Your physician's going to guide that. They will be the ones to help decide what tests are necessary to perform. And that's why I started the conversation with, let's make sure that anything that's being done is medically necessary. More questions?
There was one small part of the question that was missed. One which was how widespread the coverage is. The second part of the question was what is the process to make claims when students travel to conferences, essentially outside of Houghton? So what is the process? I think that was the whole reason for asking how widespread the coverage is.
Yeah, I may have skipped over that. So understand that the network and the coverage is national. And so the network is national. So you could be traveling outside of Houghton at conferences in the US. You still go to PHCS, you'll find a provider in New York, New Jersey, Connecticut, Arizona, wherever that conference is, you'll be able to find a participating provider because they're national, it's a national network. That's the whole point of going to the website and looking for a provider. If you don't know who to find, put in their specialty, and you'll find someone that participates in the network. I'll take that question just a little bit further. What if the conference is outside the country? Well, what happens then? So, PHCS is not international. So they're a national company. So what we see happen sometimes is that if you have an emergency or a sickness or illness and you need to see a physician while at a conference in Spain, I don't know who's going to Spain, but if you're at a conference in Spain, you may have to pay that bill at the time of service. Make sure you get an itemized bill for those services rendered with the date that the services were rendered, right? Copy of the receipt that you paid, and you submit it to the address that I shared with you on the screen, that bill. We can reimburse you subject to your plan. So if it was $100, right, and your plan covers 80, right? In this case, it's out of network, so your plan would cover 50. So it'll be 50% coverage for that. But we would reimburse you. So you still are covered. You had to pay up front, but then you got reimbursed for it. Other questions?
So the question about CHP, covering the primary rider, and what it meant was, are there particular limitations that prevent Wellfleet from being the primary in case of auto accident? That is the spirit of the question, because rather than why can't, but is it by design that Wellfleet, the insurance offer is that way?
Yeah, good question. So, and good clarification. It is by design that health insurance carriers are not primary for auto insurance related injuries. So this is not a Wellfleet rule. This is a health insurance rule. In that, when I say they're not primary, when you go to the emergency room or you see a chiropractor or you see a physician, due to an auto-related injury. The first thing they're going to want to know is, they're not going to want to know what your health insurance is. They're going to want to know what's your auto insurance. Have you filed a claim? Do you have coverage for personal injury under your auto insurance? Once those questions are answered and exhausted, it falls to your health insurance. So that's why it's not primary, it's an industry rule. What we're talking about is it's called third-party liability. I'll give you examples. You're focused on auto insurance because that's probably the most frequent type of situation you will find yourself in where you're in a third-party injury. There's others. If you're at Walgreens, right, and they just mopped the floor, and you slipped and broke your leg, and the manager comes up, right, they're going to call an ambulance. But guess what? They're going to have a form that starts getting filled out. It's an injury report. It's an accident injury report. They're filing that report because they have insurance coverage for customers who come into their store and slip and fall and injure themselves. Covers them for liability, covers them for the medical. And in that case, Wellfleet or any other insurance company is not primary. It's because of the circumstance of how you got your injury. Auto accident, slip and fall, at a third-party situation. Any other, you're not in an auto accident and you have an injury, you didn't fall at the store, your insurance is there and should be used. But what I'm explaining is not a Wellfleet policy, it's an industry policy to make sure the appropriate insurance that you buy covers appropriate. Yes.
I might have missed it, but what does Wellfleet cover as far as eye care?
So for eye care, you have, it's an annual, I'm going to have to look to Ashley, but I can pull up the program. You have two benefits. You have an annual eye exam, which can be done at an optometrist, right? Ophthalmologist, so if you have eye disease, you're seeing an ophthalmologist, that's covered as you go in network at 80%. There's a affinity benefit we offer through Davis Vision, which is on our website also. So Davis Vision is usually optometrist. You have to go to participating providers, and there's a list of providers on the website that you can go to. That basically, when we say it's affinity, they give a discount because you're a student of Michigan Tech and a Wellfleet member.
And you're only covered for one eye exam, no eyeglasses. And that's on the vision and dental sheet on the website.
Okay. Yeah.
So for eye exam, 80% for eye exam?
One exam per year.
So every 12 months, is that?
Yeah, every 12 months.
Is that fall into the deductible?
Yeah, I think, let me see. Yeah, so you will be responsible for the deductible first.
So if it is nothing.
Well,
Yeah, if
you
that's
may
the
have
first-
exhausted it already.
Yeah, if the eye exam is the only medical care that you need, then yes, you're paying into your deductible.
We are a student, and the only part of our body that we usually is our eyes and our brain. And I think the annual eye exam is very mandatory for us. And we were at the eye clinic about 1 hour ago, 2 hours ago.
Right.
And about the provider that you talked about, Davidson.
Yeah, Davis Vision.
Davis Vision. They couldn't find our name in that. They said that you don't cover with that.
Right.
You have to go on our website, go to Davis Vision, and it'll give you a list of providers. So not every provider is going to get that discount.
College Avenue, is the first one, and we went there, and they said we couldn't find your name.
So this is first of all, again, as I started the presentation, I thank you for having us here. This is what I enjoy doing, having a conversation with members, right? Understanding what your needs are and where you believe the plan could be more comprehensive. It's a very good plan, but it might be a plan that, if you get an injury or you have a long illness or you have to be hospitalized, that's great. But for some of the services that you find yourself needing or that are primary, I'd like to hear more about that. I'll take that information back. What we have the ability to do is we have the ability to work with Michigan Tech administration to modify the plan based on your recommendations. Now we have to balance that with, if we enhance this benefit, is it going to raise the premium over here and then spread it across so that it doesn't cost too much? But it becomes a better benefit. So can we talk after? Sure. That'd be great. Yes, sir.
What's the policy for seeing specialists? 'Cause I know some insurance plans, you have to get a referral from your general practitioner before you can go see a specialist and your insurance will cover it. Is that the same thing with Wellesley, or are all specialists, if they're in network, covered just right off the gate? Or
all specialists, if they're in network, are covered right off the gate. So because it's a PPO, preferred provider organization, you either have in network or out of network. You're seeking care, so it's basically you're directing where you go. You don't have to get permission. Like in some cases, an HMO where you need to go to your primary care physician first, they need to see you and then refer. In this case, no. You self-direct.
There's no deductible for a specialist. It's weird.
May I have missed it, but I want to know what's your policy for general check, like to check my blood sugar level or whatever, just to be general check.
Yeah, so a general checkup could fall into your annual physical. Blood pressure falls into that. They do a check A1C for, diabetes. There's a whole host of tests that are allowable that they do for a general checkup. The key is you have to find a physician, right, who will perform that. So you're looking for basically an internal medicine doctor. An internal medicine or family practitioner is going to, or GYN is going to be considered, your primary care provider, and they can offer an annual exam that then can provide those services. So what you can do is you can go to the website for the network, phcs.com, and you can type in, right, internal medicine, and put in the zip code for the zip code that you want to see the doctor in, and a list of participating providers will be provided. You can download that or copy it, download it to your phone, and then you can call those providers to make an appointment. And let them know you have the Wellfleet Insurance office through Michigan Tech and schedule your appointment for the annual. Sure.
Is there an option that students can upgrade their current plan, like the one that the university offers through the Wellfleet, and upgrade to like platinum that you mentioned?
Yeah, there's not an option to do that. That option exists outside of the student health plan in the marketplace, where you can go online, and I don't know if you've seen the commercials, but it's the Affordable Care Act marketplace. You can go to the website and you can pick an individual plan for yourself. The key is those plans are going to be priced very differently because those plans include a completely different demographic. The demographic for the university college student is the average age is 23. Top prescription is birth control. The demographic for the exchange, or when you go to the marketplace to buy those programs, the average age is 43. The average prescription is something for heart disease. So very, very, very different plan, very different cost. Your question is a good one. We understand. We offer one plan to all students, actually assisted and designed by Michigan Tech administration. They let us know, here's the type of plan we're looking for our students. Getting the feedback from you about eye exams, getting the feedback about understanding about a rider for auto insurance, we take that information back to them and say, we can modify the plan based on some student feedback. Here's the coverage that we can provide. Here's the premium. How would you like to proceed? And we can tweak that. So that's why I asked you to give me that. But in order, unfortunately, you can't buy an individual plan and then buy up. That happens once you're employed.
About the annual physical, I know that the doctor visit is actually 100% covered. But about other types of things like lab work, stuff that should be under the annual physical code. All of those are also covered 100%, or they go to the deductible.
Okay, so healthcare is very complex. Even physicians and hospitals in the same system can't agree. So I will answer your question by saying, if it fits into the preventive list, right, it will be covered at 100%.
Without deductible.
Without deductible. If it fits in the preventive list. But I'll give you an example. I think that's where you think you sent this question to us. So I'll give this example. Someone saw that and had the service, and IUD was covered at 100%. Right? Because it's under the preventive care services. It is covered at 100%. Right? But the provider also did an x-ray to make sure it was fitted correctly. The x-ray is an x-ray. It's not in the preferred list, prevented list of services. So the x-ray costs $600. So now the student is saying, I have a $600 bill for something that should have been covered at 100%. And we can't expect that the student was knowledgeable enough to know, here's all the list of preventive services covered at 100%, but these things, anything added extra, we were actually talking about it, saying you talk about cars, right? You have to get an oil change. So you go in and they say, you got an oil change, and if you come in, we have a sale. If you come in at the oil change, you get your oil change for free. Then you find out, oh, but you needed your windshield wipers changed also. Oh, wasn't that part of the oil change? Nope. It's like $100 for the windshield wipers. It's not exactly similar, but that's what happens. So the best thing I can ask you to do is when you're going for an annual exam, and you're talking with the doctor is not going to know. But when you go to the desk to register out and they collect your copay, or they collect that person does know. Because they checked off everything that they did that they're going to bill for. If you ever see that sheet, it's got a whole list of codes on it and a lot of checks. Here's what we did. You can ask them right now. My health plan covers 100% preventive. Is everything on here fall into that category? Is it, no, maybe the x-ray and the ultrascan are actually going to be separate. Those aren't under the preventive.
Their answer is actually different. They say, oh, we don't know until we file the claim. So the thing
that's true. You know, that actually is true because all insurance has different contracts. So they don't know exactly what will be paid or what will not. And by the way, there's 10 more people behind you, so let's hurry up. But, and I'm educating you, the codes are universal. It doesn't matter what the cost is. The codes are universal, and the codes fall into categories. So they can tell you, based on the codes, this is 100% preventive. I don't know what it's going to cost you, but it does fall into 100%. So ask the question in a way that they have learned how to provide the services.
So is there any way to find those codes?
Oh yeah, they're universal. They're ICD-9, ICD-10, preventive codes, ICD-10, preventive care codes. Okay. The whole list, 250 something codes. Because they're for children, newborns, they got to get their inoculations, right? They're for, young adults. They're for elderly. Okay? Yes.
So how do you propose to solve this problem where sometimes there are procedures that are necessary to be done, or in the doctor's opinion is necessary to be done, may not necessarily fall into the strict realm of preventative care. This seems like a really huge problem. But what can you do in order to mitigate that cost?
So I'm trying to maybe understand the question. If the question is to mitigate the cost, right? What we have to understand, that there's two things that are very expensive in this country. One thing impacts us every day, one thing we hardly see. Two things that are very expensive in this country are healthcare and military spending. We feel the impact of healthcare all day. You will not believe that a child, right? This is why we have a program for young mothers, right? To make sure that they follow a regimen, as their expecting with their young children, because we want to make sure they go and see, their OBGYN on a constant basis, that they keep up, and that they have well baby care. Reason we do that and we cover those types of services is because if not, they could become at risk, and they can have a child early. And if you have a child early, let's say they have to deliver a child, a preemie, 3 months in advance, that child has to be in the neonatal, the neointensive care unit. That's $3,000 a day for 3 months. Now, no accident. I'm going to get to your question though. It's no accident, right? But if the care had been delivered in a constant manner, maybe that child would have gone full term. And that's the goal, have a healthy baby, right? Healthy delivery. Maybe that child would have gone full term and they wouldn't have had to be in the neonatal ICU. And they wouldn't have had to have a $250,000 bill, right? When you have a plan that you pay $2,500, but you have a $250,000 bill. That's why people have insurance. So healthcare is extremely, extremely expensive. So the dilemma of what falls into preventive care and what falls out, the actual question really is, what care do I need? So I'm not here scheming to say, how much can I actually get at no cost? I actually want to get the right care at the right time, at the right place. And I'm willing to pay my fair share, because I know what my plan says it covers. I'm willing to pay my fair share, but I'm going to be educated about what I ask. So you asked an excellent question. What are the preventive codes? Because you know the game that the office plays, because they don't have time to sit and explain to you, and you saw the hospital, how many insurances it accepts. They don't know if you have Blue Cross Blue Shield or Aetna or United Healthcare or PHCS. So be informed and understand, well, I know generally for me, these are the services that I think I need. I know I need to get an x-ray. I know I need to get blood work. I know I need to check on diabetes. But if my doctor starts talking about these other things, right? I need to do a PET scan. I need to do an MRI. That's a red flag. And you ask at the desk, is that covered under preventive? Yeah. No, that's not a preventive. That's a diagnostic imaging that's going to go towards your deductible. As soon as I say that's a diagnostic imaging, that's going towards your deductible. A $1,500 PET scan, right, is going to go towards your $750. So I don't know that we can actually solve it, except to be more informed consumers. I see that we're doing that with other things. We compare on Amazon, we compare on Best Buy, you look at the technology, you look at this thing, you see it, and you go in the shop, you say, this one's $30 less, and you confirm all of the key requirements of that particular item to a degree. And then you make your commitment and you buy. You execute. You already know how to do it. You just haven't applied it to health insurance. Other questions? Yes, sir.
What's the cost for insurance?
That depends. That's actually what that's what a physician's office would say. We are actually going to be putting on our website. It's probably not going to be on there until March of next year. A cost of care estimator, basically a tool that'll allow you to put in a procedure code, like the code for 5-digit code for an MRI. Put in your zip code. It would actually tell you what the range of cost is for an MRI. They run around $1,500 MRI. PET scan runs about $3,500. That's what the hospital or the facility charges for those services. Any other questions? Well, thank you. Ashley and I appreciate your questions. Thank you.
Thank you so much. There's food. Please grab some food, and if you have some conversations, some final comments, please. We have them here for some time, but they also have to leave. So try and make it quick. And the recording will be uploaded sometime soon. So thank you again for coming. Yes.
also make their website.